Is it okay if I can come in?
Yes, go right ahead.
Thank you. And is it okay if we could close the door for some privacy?
No, go right ahead.
That's okay?
Thank you.
Okay, we'll go ahead and we're gonna close it. All right. Hi, my name is
Hi.
Bianca. I'm
Hi,
a
Bianca.
full-time nursing student at Nevada State College.
Okay.
And I'm here today with my professor, Marcellus.
Okay.
Okay, so today we're going to be doing some vital signs, and we're going to do a quick assessment. Is that okay?
Yes, that's fine.
Awesome. All right. And how are you feeling today?
I have a lot of pain.
Oh, I'm sorry. Well, we're here to make you feel better, okay?
Thank you.
That's what's important.
Yes, it is.
Oops. All right. Let's see. Can you please tell me your name and date of birth, please?
Yes, Veronica Fernandez. My date of birth is 11/26/1965.
Awesome. Thank you so much. All right. So let's go ahead and get started.
Okay.
And do you know what day it is today?
May 13th, 2020.
Awesome. Okay. So we're going to be checking your temperature. So can you open your mouth, please? Okay. And lift up your tongue. I'm just going to put it aside. Please don't bite down.
Okay.
So one moment. Okay. 98.7.
Is that good?
Yes, that's great.
Good.
All right. So we're going to check a little bit of a few more things.
Okay.
So let's see. You could go ahead and rest your arm. Okay, so we're going to be doing your blood pressure.
Okay.
And what's your normal blood pressure like?
It's about 100. It's always normal, usually normal, about 138 with 35/70, 68. It's usually normal, put it that way.
Go ahead and relax your arm for me.
Okay.
Go ahead and relax your arm on me. You can put it down. Okay, so it's going to be 128/62.
Is that good?
Yes, that's good actually.
Good.
You are in normal range. So I'm just going to go ahead and take this off.
Okay.
Okay. All right, so we're going to be checking your respiratory.
Okay.
So I'm going to grab your arm and I'm going to be putting it against your chest, okay?
Okay.
For 30 seconds, so just relax for this process, okay?
Okay.
All right. So can you please tell me why you're in here today? And what brings you in?
Because I have a lot of inflammation that causes my pain in my back. It started with my lower back and it's just moved up all the way to my mid back. And it's terrible. I get flare-ups and not even my pain medication helps. And I have to come to the hospital.
I'm sorry. So with the flare-ups, what kind of pain they cause? Like the back pain? Like, can you describe it to me, please?
Yes, it's just really bad pain. Starts from the back and it just moves all the way all to my left, all into like under my breast. And on my breast, it really, really hurts. terrible.
So the good thing is your respiratory is 16, so that's good.
Okay, good.
So good to know. So I'm sorry about the pain radiating. So how long has this pain going on for? Like, is it new, like with the radiating, or how?
Well,
explain to me, please.
Well, I've had 3 back surgeries. My last one was in 2010, and it was a fusion. They removed several discs, and I was in pain, but just the pain has gotten worse now in the last year and a little over a year and a half.
Mm-hmm.
It's just gotten worse, and it gets to the point I get a flare up, like up right here on my left side, and it just it's constant. It doesn't stop. It's just there. And yes, I do have pain management doctor, and they give me Norco, 10 milligrams, and naproxen 500 milligrams, and it does not work. And what does work is IV steroids, like a 5-day treatment, and that will calm it down.
Okay. So by any chance, have you had any other surgeries besides the back surgery?
Well, yeah, I had like a hysterectomy. I've had a deviated septum. My right knee, I had a meniscus removal. I think that's it. Oh, gallbladder removal. I had that.
Oh, wow.
Yeah.
Okay. So besides the medications you're taking, is there any other disorders that you have that are presented?
No, it's just that the flare-ups get really bad.
Oh.
Very, very bad.
Very bad. Okay. Are you taking other medications?
Well, for diabetes, yes.
Okay, so you do have diabetes.
Yes,
That's
I
another
do.
disorder that you have.
Yes.
Okay. Did you get it as early childhood or later on in life as an adult?
No, I was at the age of 15. They told me I had was like a borderline.
Oh, okay, so you got it later on in life.
And after that, no doctor ever told me anything. After I had my daughter, that's when it got worse, and that's when they started treating me for it. They put me on insulin, metformin. So, but between 15 years old and 30 years old, between those 15 years, nothing, I was fine.
But now that you're older, you are insulin dependent.
Oh, yes.
Correct?
Yes.
Okay. And what are you taking for the diabetes?
The metformin,
Okay.
500 milligram, twice a day. I take Trulicity once a week. Humalog, 10 units, 3 times a day. And Lantus, the sliding scale, which is only at night. It's like 40 units.
So since you are a diabetic, can you explain to me how your diet is?
Yes, well, I eat a lot of vegetables. I try to like eat healthy because of my diabetes. But I mean, I'm not 100% that I eat very healthy, no. But I do try my best.
Okay. Do you incorporate carbs and sugars in your diet, even though you're diabetic? Or do you try to minimize it?
I try to minimize it, but I get the craving for sugar, and I have to eat like a cookie or a piece of cake or something. Yeah.
Okay. So it's like here and there where you do eat sugar.
Yes.
Okay.
Yes.
Well, that's not too bad, but definitely try to stay away from this.
Yes, I know.
So how about for exercising? Do you exercise?
I minimize in exercising due to my back problem. I cannot go to like a gym and exercise. No, I can't. What I do to help myself is to do some walking, like around the block, or go to the mall, walk around like maybe once. But I could only do that one time because I have nerve damage in my legs. So I need to like come back home, lay down, sleep and rest because my legs are really bad too, due to my back problem. And so I'm really minimized in exercising, like I said.
Okay. But you do try to like go walk around as
Oh
much
yeah,
as
I
you
do,
can.
because that's
Okay.
what helps me.
Okay, well that's good. I think thankfully, you know, you do incorporate it and you try to get that going.
Yeah.
So are you immunized by any chance? Are you up to date with your recent flu shot for the year?
No, because I had it 3 years ago. I decided to have the flu shot. I was not sick, but when I did get it, I ended up sick. And I had to end up in the hospital for 4 days with fever. And so I refused to get it done.
Okay.
I don't like it. I'm scared of it, actually.
So even if we recommended it, you wouldn't want to proceed?
No, I wouldn't. I'm sorry.
It's okay. We respect your decision. By any chance, do you have any other immunizations done?
Well, yeah, when I was a baby.
Oh, okay. So you're up to date with all your immunizations.
Yeah, I have everything.
Okay, well that's good. That's important. Are you allergic to anything? Like any food allergies?
Not food allergies. I'm allergic to Biaxin and Livaquin.
Okay.
I get like a bad rash on my forehead and on my scalp if I take that. So I haven't took since I was found out I was allergic to them. My doctor never gave it to me again.
Oh wow. Okay. Are you allergic to latex?
Yes, I am.
Okay.
Yes.
Are you allergic to any pets?
To cats.
To cats?
Yes.
Okay. Also, let's see. Okay. By any chance, do you smoke?
No, I do not. No.
Do you drink by any chance?
No.
No?
Do not.
Okay, good thing you're away from that. Let's see what else. So on a scale of 1 to 10, 1 being little to no pain, and 10 being the worst pain, how would you describe your pain right now?
Honestly, a 10.
10?
I'm in a lot of pain.
Oh, I'm sorry to hear that.
I know, me too.
But we're definitely going to make you feel better.
Yes.
So I do want to get a little more about you. What's your occupation? What do you do for a living?
Well, I used to work for Culinary Health Insurance for 22 years, but when I got my surgeries in my back, they disabled me.
Oh wow.
The doctors did, and they said I couldn't work no more. And since 2010, I've been disabled.
Oh wow. So you do have a big background on healthcare.
Yeah, I do.
Oh, that's
because I did it for 22 years. Yeah.
Oh wow. Okay.
I liked my job. I loved it, but I couldn't go back.
Oh, I'm sorry.
Yeah.
But definitely taking care of yourself is priority.
Oh, of course.
Also, can you tell me a little bit about your family history, such as like any illnesses that run through the family?
My parents, my dad, he passed away already. He had, thank you, he had cancer, pancreatic cancer, and he was diabetic, and he had both his legs amputated, and he was a diabetic for 44 years.
Oh wow.
And but he passed away, and my mom, she's diabetic, but it's under control.
Good, that's good.
Yeah.
Is there any other illnesses such as like hypertension?
No, actually no. No. It's in my family, what runs is cancer and diabetes. That's it.
And not even high cholesterol?
Nothing. No.
Okay. All right. So definitely we are going to get you treated and we're going to make you feel better.
Thank you.
You're welcome.
Thank you.
Okay. So my patient, Veronica Fernandez, she's 54 years old. She's a female. Patient came in for radiating back pain. Severity is a 10. Patient's blood pressure is 128/62. Patient's temperature is 98.7. Patient's respiratory is 16. So patient does appear to be alert and orientated 3 times 3. Thank you.